And a very pleasant good afternoon, ladies and gentlemen. Chris Babcock coming to you live from the heart of the high desert here in Horizon City with our partners at El Paso Physical Therapy Services. Today, we're going to have another live demonstration, and with us today is Rudy. Rudy, how are you doing?
I'm doing well. Thank you for having me.
Well, I'm glad. What are we going to be looking at today?
You know, it's the fall. The fall started, and we're in full swing of fall, so we're going to talk about fall prevention.
Fall prevention, all right. And I noticed we've got a chair, we've got a prop today, so we're going to be using that. What is that about?
Well, this is so we can show you and demonstrate one test that we do for lower extremity strength, so that if you're weak in your lower extremities, your fall risk is higher. So we're going to show you how to do that test.
Okay, very well. And we do have, once again, we've got someone else who's going to come on board with us and try this out?
Absolutely. We'll have Rosie, which will be our patient, and we'll have her demonstrate exactly what the test is.
Excellent. All right. So let's call Rosie in. There she is, Rosie once again. Hello, Rosie.
How are you doing?
I'm good. Once again, we're having Rosie on board, and go ahead and explain what this is going to do.
Okay, so you know, several things we can do. Falls and the risk for falls will highly diminish your ability to live an independent lifestyle. So even though 1 out of 4 elderly adults will fall, falls is not a normal process for aging. So you yourself can have a high impact on reducing your fall risk. Physical therapists like myself can assist you in getting to those goals of not falling as often. So this test will, if you have a weakness in your lower extremities, because I'll touch on 7 different points here. The first point is assessing your risk for falls. One test that we use for that is a 5-time stance test, which I'm going to demonstrate right now. Rosie's sitting here. I'm going to give her some instructions. Rosie, I want you to sit with both feet flat on the floor. I want you to cross your arms in front of you. When I say go, I'm going to time you. So when I say go, you're going to stand and sit. You're going to stand all the way up. You're going to sit all the way down 5 times as fast as you can, as long as it's a safe procedure for you. Okay. If you hurt anywhere, you stop at any point. Okay. Are you ready when I say go? And you stop by sitting, not standing.
Okay.
Okay, go. 1, we start the timer. 2, 3, she's going as fast as she can. 4, 5, and stop. I stopped the watch, and the timer says 11.47 seconds that she did it in. Normally, for a 65-year-old and older, 12 seconds is the norm. Mm-hmm. So 11.4 is not bad, but it does give me an idea as to what I need to do with her lowers in order to increase her strength.
And basically, once you get that baseline, then you can go back through, and as your therapy progresses, you can actually administer this test again in a week, 2 weeks, 3 weeks, and figure out where they're at.
Correctly. And we can then advance the program according to those results. So the second point I want to touch upon is designing an individualized plan for your fall prevention. So once you come in and we evaluate you, and we use a plethora of tests, but this is strictly just one example, we will determine if your falls are happening because of lower extremity weakness, posture, flexibility, endurance, or a neurological problem. Once we find out what that plan is, then we will develop a plan for you individualized so that we reduce your fall risk. A third point we want to touch upon is working and helping you make your home as safe as possible. Because as it has been well documented, most falls occur at home. Yeah. So we will assess you based on those findings and the evaluation and ask you about your home environment. Now, do you have area rugs where you could step and fall and slip and then you have an injury? Or do you get up at night to the bathroom, and from going to bed to the bathroom it's dark, you trip on something and you fall, so you need to have night lights available. Also, if you're weak or you have a disease like diabetes with neuropathy, you don't feel your legs, you need to have an assistive device next to you, like a standard walker or a cane. The third point we want to touch upon is educating you about the medical risks associated with falls. So are you on multiple medications that could possibly interfere with your balance? And so we will go over that list, talk to you about that, so you can then have an educated discussion with your physician and modify it accordingly.
And again, these are all different. These different points work together. This is not just one separately. This is an entire continuum of a program.
It is a program that we utilize in order to make sure that you reduce your fall risk. So the other point that I want to talk about is providing you with appropriate exercises and balance training, because your balance and your falls can be determined by a lot of factors. Posture, for instance, if you have bad posture and your center of gravity is here, your chance of falling is higher than if your posture is up here, normal, and your center of gravity is in the middle. So we'll talk about that. We'll talk about why is it that you're having other medical issues, like if you have diabetes with neuropathy, like I mentioned earlier, or if you have Parkinson's, or if you just have a sedentary lifestyle. Increasing your strength, your stamina, your flexibility will decrease your fall risk.
So it's basically going through the entire list and then saying, okay, this is what you have, this is how you can prevent it, and this is how you guys help out.
Exactly. That's exactly what we do, and what we try and make sure that we get you to your goals that we evaluate in the beginning. So then we also work with other healthcare professionals in order to address any underlying medical conditions that you might have, like I mentioned earlier, Parkinson's, diabetes, sedentary lifestyle, weakness, anything that has to, or a neurological problem. If you have BPPV, which is benign positional vertigo, when you get up from bed, you feel dizzy. We'll show you some exercises to decrease that and improve your ability to walk and stand without having fear of falling.
I can tell you firsthand that I've taken a couple of hits to the head, and I feel sometimes when I get up too quickly, I feel like that's sudden. And I can imagine that if someone has these as they get older, that just that little half a second makes a difference between standing or falling.
Exactly. And once you fall, your fear of falling increases by a multitude. And so we have to make sure that we get you over that hump of not fearing a fall, because once you do that, you'll tend to fall even more often.
And they become more sedentary. They don't want to move. They don't want to do this.
They're afraid of falling. And so they don't want to move, like you said. And then, lastly, what we can do for you, or second to last, is providing you with recommendations on appropriate community programs. El Paso is a huge community, and we have programs. So for instance, I'll give you an example. If you fall and don't know how to get up, we have the Med Alert bracelets, where you can just press a button and EMS is there immediately to help you get up. Or we'll show you how to get up from the floor as we do your evaluation.
And it's basically using those things that are around you, trying to boost yourself up in a safe manner.
That is correct. Have you fallen and used that before?
Actually, we've had my great-grandmother and my mother-in-law that they've had to learn how to get up, and it's one of those things where you don't think about it, but as part of the therapy process, you need to be educated on it.
Absolutely. And it's very important that everybody know how to get up from a fall. So we try and teach that to everybody that comes in here for the fall prevention program.
And again, all of these are available here at the El Paso Physical Therapy Services, not just here in Horizon, but the ones that are scattered throughout the city. They're in your neighborhood, but especially here in the high desert. Rudy, I'll leave you with the last word. What do you want to say?
Well, I just want to say thank you for having me here and allowing me to come into your homes to talk about fall prevention. Very important. If you need a consultation from a therapist, please let us know. We're here in the Horizon Valley, the high desert, like you mentioned, and we're here to help you. So give us a call.
And all that information is going to be right below this video. We're going to go ahead and tag them. You'll see the website and the phone number. But for now, for Rudy and everybody here at El Paso Physical Therapy of Horizon Valley, here in the high desert, Chris Babcock saying, have a good evening, everybody.